everyone. In this lesson, we are going to talk about tonsillitis. Now, tonsillitis is a very straightforward diagnosis, and so we're just going to cover it very quickly. And what we're going to do is spend the majority of our time talking about nursing care following a tonsillectomy. You see tonsillectomies all the time on pediatric wards, and kids who have tonsillitis really frequently would be candidates for this surgery. So it's connected in that way. But your nursing care for a tonsillectomy is very specific and very important. So that's what we're going to spend the majority of our time talking about. Okay, so tonsillitis is when the tonsils on either side of the throat, here and here, become inflamed and infected. Now, kids are actually more prone to this infection than adults are because their tonsils tend to be larger. Most of the time, the cause is viral or bacterial, and the most common bacterial cause that we see is group A strep, which we commonly refer to as strep throat. All right, in your nursing assessment, the main symptom is going to be a sore throat. And sometimes this can actually be so bad that the kid has difficulty with eating and drinking. So in severe situations, they may actually become dehydrated. Now, if you take a look at the throat, it's going to be red and swollen, and then you may see white spots or white exudate as well, which are indicating that there's some infection there. The child's also going to probably have a fever and feel really crummy, and it's not uncommon for them to have really foul-smelling breath. So that's something you may hear from the parents when they're describing the symptoms. Management really needs to start with a throat swab because this is going to tell us if the cause is bacterial. If it is bacterial, we're going to need to give antibiotics. If it's viral, our treatment's really going to be about supporting them. So we're going to give antipyretics and analgesics to help with that pain and discomfort that they're feeling. Now, kids who have a lot or really frequent episodes of tonsillitis may actually be candidates for a surgery. They may need to have a tonsillectomy and an adenoidectomy. And this procedure is also done for kids who have sleep apnea. Now, this is a really common procedure, like I said at the beginning, so we're going to take a few minutes to talk about your nursing care for it. So TNAs are common and also straightforward. Some kids actually can go home the very same day they have the procedure, but there are some life-threatening complications that can occur. So we've got to know exactly what we're looking for so we don't miss them. So the first thing we have to do is monitor for airway obstruction. So they've just had surgery on their throat. So if the edema and swelling from this procedure becomes severe enough, it can actually block the airway. So first of all, keep an eye on their respiratory status. Then your major red flag symptom that you're looking for with airway obstruction is excessive drooling. So if you notice that there's excessive drooling, you've got to make sure to let the provider know straight away. Your next priority is to assess for signs of bleeding. And the red flag symptom here is excessive swallowing. If they're bleeding, the blood's going to be draining right down the back of their throat, which is going to cause them to swallow a lot. We're not necessarily going to see that blood unless they vomit. So if they vomit, be looking at that because they could have bright red blood there, and that would be your other sign that the child is having bleeding. And this leads us to your next really important nursing intervention, and that's protecting that operative site. This means that child doesn't need to be using straws. That sucking mechanism can cause those sutures to open up, so no straws. And we also want to make sure they don't eat any sharp or crunchy foods like Doritos. They need to be on a clear liquid diet or a soft diet to start with. Now, also make sure that they don't eat any red Jell-O or red popsicles because if they do throw up, we don't want to be confused by what we see there. Now, in spite of this being pretty straightforward and common, it is also a really painful procedure. And kids actually handle it a lot better than adults do, but they will still have a lot of pain. So our pain management is very, very important. And the biggest issue we see with poorly managed pain for our TNAs is prolonged hospital stays. This is because if they're hurting, they are not going to be eating and drinking. And if they don't eat or drink, they can't go home. So most are going to be offered or have opioids prescribed for the first day or so. But a lot of times what we do is we have acetaminophen or other pain medicines scheduled for those first 24 hours. And this is just to make sure that they don't get behind on their pain and they don't get dehydrated. And this makes sense. Our next major thing that we're looking for is monitoring their hydration status. Like I said, dehydration is a really common complication because it can be a real battle to get those fluids and medications down. But it's really important. So we offer fluids in small amounts via syringes, and then we also offer popsicles because kids love those and they usually go over pretty well. So if we keep an eye on these complications while they're in hospital, we can help prevent them and make sure that they have a really quick hospital stay and they're able to go home. And that leads us to the next point, which is really important to make sure that parents know what to be on the lookout for. Bleeding can actually happen up to 14 days post-operatively. So parents have to know to be on the lookout for that. And then kids are readmitted for dehydration quite frequently for this. So encourage parents to use those little syringes and to use popsicles and things that are really going to help prevent that. Your priority nursing concepts for a pediatric patient who has tonsillitis or a post-tonsillectomy are infection control and fluid and electrolyte balance and comfort. Okay, so let's go over your major takeaway points for this lesson. So first thing is knowing that tonsillitis is when the tonsils become infected, and it can be either a viral or a bacterial cause. If it's bacterial, we're going to need to give antibiotics, and the most common bacterial cause we see is a group A strep. Kids who have frequent episodes of tonsillitis or sleep apnea may need to have a tonsillectomy done. And during your post-op care for a kid who's had a tonsillectomy, your top priorities are to monitor their airway and monitor for bleeding. And the symptoms you want to be on the lookout for are excessive drooling and excessive swallowing. It's also super important to manage that pain because we want to make sure that they're comfortable, and we also want to make sure that they can drink those fluids and that we can prevent dehydration. And don't forget, our parents of these kids also need to be aware of these complications because bleeding can occur up to 14 days after surgery, and they'll be at really high risk for dehydration if we don't make sure our parents are aware of that. Okay, you guys, that's it for our lesson on tonsillitis. I know we talked a lot about tonsillectomy care as well. I'm certain that you're going to run into this type of patient on your pediatric clinicals. So I hope that you find this information applies directly to what you see there. Make sure you check out all the resources attached to this lesson. Now go out and be your very best self today, and happy nursing.